Hey there, welcome back to the show. We're pretty excited about today's show because today we're going to get in a conversation about psychedelics and the, big wave that is we're kind of on the beginning of right now around the use of psychedelic medicines in psychotherapy and exploring the promise of psychedelics and also maybe where some of those promises might not hold up and where some of them are very much um, looking positive in terms of efficacy of psychedelics and how psychedelics can be used in people's journey where they're struggling either with trauma or depression, anxiety. So there's a lot of different things to cover around psychedelics, what's happening, the pitfalls, what to look out for. So really excited about this conversation. A lot of people have a lot of questions. And this conversation is also coming off of that. We're also about to open registration soon in a new psychedelic therapy training that we're also been putting a lot of time in and super inspired about offering something to the professional field here about how to get really well trained in how to use these medicines and this technology with people, and that's coming soon. So be on the lookout. In the next couple weeks, we will be having information on our website. You'll hear more on our podcast about this new psychedelic therapy training. It's going to lead to a certification that will really start to legitimize the field. So more to say about that. But right now we're going to dive in, Will and I, on the conversation about psychedelics and mental health, and we'll see where this takes us. You want to start us off, Will?
Sure. Thanks, Keith. Yeah, I'm really excited about this upcoming training as well. So for those of you who haven't been paying attention, which there's probably not that many people out there who haven't heard already that psychedelics are coming forward in mental health care as a up-and-coming treatment that's being studied and pretty actively right now in research. The background is that we've really struggled to get a handle on rates of depression and PTSD in particular with standard treatments, and there are now phase 3 trials going on for the treatment of depression and PTSD using psychedelics to treat these really difficult conditions, really disabling conditions, and really rampant sort of epidemic level, out of control levels of depression and trauma. So I had the experience for several years working with the Multidisciplinary Association for Psychedelic Studies on PTSD trials using MDMA-assisted therapy to affect rapid and lasting change in people. And I walked away from those experiences feeling incredibly excited and enthusiastic about the future of how we can help people who have some of the hardest, longest standing symptoms really start to get well and put PTSD behind them. There are also big trials happening with psilocybin for depression. So the early research with psilocybin depression is really exciting too. Really high levels of effectiveness. And so there's a revolution happening in the world of psychotherapy. And it's probably the biggest change, Keith. I'm curious what you would say about this. Probably one of the biggest changes that's ever happened in terms of the field of psychotherapy.
Yeah, that's a good launching pad right there, which is that I think there's been moments in the history of psychotherapy where a new modality or, a kind of a new school of thought starts to rise. But this is different, right? Because now we're talking about a new technology along with the therapy It's kind of like when we think about like EMDR's rise or something, but this is really different because this is about a medication-driven therapy. So I think you're right. I think this is starting to look like it might be one of the biggest shifts in the field of psychotherapy in our lifetime, and something that will probably likely influence the field of psychotherapy for many, many, many generations in terms of what people really rely on as one of the main go-to tools. I don't think it's going to be in every therapy, obviously, and it shouldn't be, but it's massive, what's coming here. So it's exciting, and probably a good I think a good launch pad here for us is to just kind of go over a little bit about different medicines right now. What's you kind of named them quickly, but just let's go over different medicines, what people are experimenting with in more recreational settings, non-medical settings, and then we could kind of circle back to what hopefully we're going to see, hopefully make it through the phase 3 trials. And we can kind of give people a little bit of a overview of different medicines, and what are the kind of benefits and pitfalls of these medicines and things. Does that sound like a good place, Will, to start?
Sure, that sounds great. Yeah, absolutely. Well, I'll just jump in and say, obviously since the 60s, there's been non-medical use and a lot of interest in expanding consciousness with psychedelics. And for the most part, I would say, if you look at studies that look at how many people have actually done psychedelics in a non-medical setting, the rates of having a really serious negative experience are exceedingly low in those situations. So I want to set that framework, just in terms of the massive amounts of millions and millions of people using psychedelics for their own personal psychological exploration or recreational use. And at the same time, just as an aside, we'll probably get further into this later, but we don't condone non-medical use because of the dangers that are posed by that can be controlled in a medical setting, along with the reality that these drugs are still on Schedule 1 with DEA, so you can get in big trouble for holding them or using them. Or so what we're seeing, and it's really fascinating to me as a psychiatrist, is people are out there experimenting quite a bit now with the release of Michael Pollan's book a few years ago, How to Open Your Mind. There seems to, and with the psychedelic research more and more in the press, more and more people seem to be going out and doing non-medical sessions or experimenting. And they're using LSD, using psilocybin, MDMA, sometimes combinations of things, ketamine, and you didn't mention, but there's also this indigenous tradition of using psychedelics like ayahuasca or peyote in a very traditional spiritual context. It's been going on for thousands of years. So,
as a psychiatrist at best, what we see with non-medical use is that someone has a mind-opening experience that's not scary or traumatic. At worst, a person could have a traumatic experience, and we see that quite a bit. People coming in who have had difficult experiences, who need a lot of support. And so we would rather that people have the support that they need to fully make use of and integrate a psychedelic experience, which is why we really advocate for using these medications in a really safe and well-designed setting, and with a guide who can really help people through what they need to face in order to get well.
Yeah, I agree with that perspective too, obviously. And it seems like, so obviously there's going to be plenty of people out in the world that are going to be doing psychedelics till the end of time on their own. And a lot of kind of garage shamans popping up these days, running circles in their garages or whatever. And that's going to happen. And I mean, there's so much that comes out of psychedelic use. Some people obviously have near-death experiences on them. They can have a catalyst experience, a spiritual experience. They can have a regressive experience into their own psyche and get into childhood experiences and transpersonal experiences. And that it's such a smorgasbord of what could go down on psychedelics. And for better or worse, I mean, some of that's amazing, and some of it, if you don't have the right support, like you're saying, it can actually be severely traumatizing, because you're left to kind of fend for yourself in your own mind, and sometimes things can get too chaotic too quickly, and if you don't have the right support, it's overwhelming. So that's where we're at, right? In the context of just culture, is we've got a lot of people very interested right now in psychedelics. A lot of young people particularly are interested in psychedelics right now. And then we have the whole medical field that got interested to really take a good look at it, which is so exciting. And it might be useful just to break down a few psychedelics that are being used often right now. And again, we'll kind of, for the listener, we'll kind of differentiate between what's being researched very heavily versus what people are just sort of doing in their own way, recreationally. And that's not even probably the best term, because a lot of people don't believe they're using them recreationally. But so why don't we start just with first ayahuasca? It's a big one. It's on a lot of people's minds. Some people don't even know what it is. And we could just say a little bit about, that this one's not that far along in research, in terms of, are we even in any, we're not even in any FDA trials, are we, Will, with ayahuasca?
Not in the U.S., which is what you mean by FDA, obviously, but there have been some double-blind, placebo-controlled trials in Brazil for depression, treating ayahuasca for depression. It's really difficult to study ayahuasca for a number of reasons. One being that it's a blend of different plants that has a different recipe for almost every batch, and different indigenous traditions. There's different ingredients in it. And the traditional context is to drink ayahuasca in a circle with a shaman leader. And so in terms of Western kind of American scientific study design, you've got a large effect that's coming from the context, from the community, from the shaman. And then you've got a substance that is kind of a potpourri of different plants. So, in terms of studying ayahuasca, you'd have to, and there's a lot of different kinds of feelings people have about this, but you'd have to isolate out, one or two components to try to study it. So it's difficult to study, is all I would say.
Right. It's difficult to study. And in terms of just people's knowledge, there's a lot of people experimenting with ayahuasca. Sometimes that's within like more of a sanctioned church. Sometimes people fly to South America, Central America, different places. And ayahuasca tends to be a fairly powerful psychedelic, we could say, right? It tends to be a powerful, strong experience. Not always, but tends to be. It's definitely not for the faint of heart. It tends to be something that can induce a lot of regressive experiences in oneself. It can induce a lot of physical discomfort and overwhelm. It can also, obviously, some people experience a lot more of this spiritual, transpersonal stuff with ayahuasca. But I think overall, like the takeaway with ayahuasca is, obviously, it's not legal to be doing outside of a sanctioned church, but outside of that issue, it seems to be a more aggressive psychedelic. Would you agree with that?
The way I like to think about it is that the experience is a lot more difficult to titrate or to control. So maybe that's similar to what you're saying when you say aggressive. I think that when someone takes ayahuasca, they're opening themselves up to what comes toward them, or what comes out of them, what comes out of their psyche, or, as you said, from the transpersonal realm. And it's extremely common for people taking ayahuasca to encounter incredibly challenging and difficult and scary material. So I don't know if I would call it aggressive, but I would say that it's just really hard to know what kind of experience you're going to have. And so I would say it's definitely not for the beginner psychonaut, because there is a level of kind of progression of being able to navigate psychedelic spaces that you wouldn't necessarily want to throw somebody into an ayahuasca experience early in their exploration of psychedelics.
Yeah, I think that's a good way of saying it. It's definitely not, generally speaking, one of the softer experiences that these medicines could be used for. It tends not to be soft. So that's ayahuasca. And of course, there's, I'll share for a few minutes, just a little story of being in Colombia, in a beautiful indigenous ayahuasca church in Colombia on the beach, and with a 100-year-old essentially shaman, and the shaman below him, and the shaman below him, and the shaman below him, and very beautiful context, and set and setting, everything's right, and then also knowing that one night, many nights in a row, and first night everything was just more kind of like being in touch with nature and being in the jungle there and connecting to the jungle and feeling that connection, and wonderful. And then night two, for me, it was like laying next to the fire thinking it was the last night of my life, and witnessing everybody at my funeral. And so it's just, I think my takeaway with ayahuasca and is that set and setting obviously matters, and also like the right support matters, and also we don't know a lot about ayahuasca in terms of, like, if we're really talking about mental health, which is the focus of what you and I focus on, not spiritual experiences or like just mental health, like what that really means, and the possibility of getting into mental illness. Like, we just don't know a lot about ayahuasca at this point in terms of what is it really good for in the space of mental health, and what it's not good for, and when to avoid it and when to use it. Like, would you agree that at this point we just don't know that much?
Well, we have some very early studies on ayahuasca. Like I said, there was a placebo-controlled trial in a hospital in Brazil studying ayahuasca for depression that returned a positive result. Small trial. Way too early to say whether that would ever become some kind of widespread approved treatment. And the FDA would have to go through a process to even look at that, which it's not doing currently. So the other thing that has been reported observationally out of Brazil is that people with addiction who regularly use ayahuasca in a spiritual tradition seem to maintain higher rates of sobriety than people who don't. So there's that. But again, it's pretty limited in terms of the research.
Right.
And the other
that's
thing
also
I'll say
happening
is
in
that
Peru, obviously, too, for addiction.
Yeah, absolutely. And another thing that I've seen a number of times in my clinical work is people coming back from Peru, having taken ayahuasca and having had a really, I would just say, frankly, traumatic experience in Peru. Usually, what's traumatic about those experiences is when you're working with a shaman who doesn't have much understanding of the North American kind of neurotic structure or the North American psychological issues that we face that are different from the common challenges people have in indigenous situations. And so I've worked with a number of people who came back from Peru having had fracturing experiences with ayahuasca that they needed a huge amount of integration to and trauma work to heal and get stable again. So having ayahuasca experiences inside of a indigenous or traditional setting is not necessarily automatic protection from getting fractured and having a difficult experience that takes weeks or months to integrate.
Well, one thing you're pointing out too, one thing you're pointing out, Will, is sorry, we're having delay. We're having delay, but so one thing you're pointing out, Will, too, is that set and setting with any psychedelics matters a lot, but it's not the whole. It's actually not the whole issue. Like that is very important, set and setting, but your guide matters a lot. That's one issue, which is that the person trained to guide these experiences, if we just get out of ayahuasca for a second, their training matters, because if they don't have a lot of training around ego development, trauma, psychological splits and states, and mental illness and mood disorders and all that stuff, like it's hard to, like, we could obviously guide people in more of a spiritual context, and that's one type of person that can handle just being guided in a spiritual context. But when we get into more of these mental health states, a good amount of training is important to recognize what's going on. And the other thing I wanted to add there, Will, that you were talking about is like we were talking about ayahuasca, but you mentioned something that's really challenging, which is like the dose of any of these medicines. And it's very easy when we're outside of medical settings. And I think this is the biggest drawback outside of medical settings. It's so easy to actually take more than you need, and end up basically getting in over your head with a medicine. And I think that's a really important thing. There's a reason there's a scientific method in testing medicines and dosages. And it's the same thing in psychedelics, which is that it's so easy to actually take more than you need. And so many people respond differently to psychedelics based on their metabolic structure. And so it's easy to get in over your head, especially like we were talking about ayahuasca. That's really easy to get in over your head. You have no idea you have no idea how concentrated that liquid is you're drinking. You have no idea how much you actually need if you've never done it before. And I think that's a real factor that is not really handled, typically speaking, that well outside of the medical setting, which is like how much is going to really be useful here and how much is going to be too much. And now you're just dealing with too much medicine in your system and you're overwhelmed and really just needing to hold on with a guide, hopefully, right?
Right. Yeah, absolutely. And there's another dimension here, which kind of goes to what you're saying about the training of the guide. But I just want to put this out there for all of our listeners that a lot of times people with, mild to moderate symptoms have something going on that's very deep in their psychology that is sort of like the root cause of their symptoms. And when you take a psychedelic, that material can come out very abruptly. And I've seen this happen over and over again, not just in our ketamine clinic, but also in the MDMA trials that I participated in with MAPS, and also, in my trips that I've made to South America to experience ayahuasca. I've seen people who didn't know that they had a very serious childhood sexual abuse, or didn't know that they had a massive abandonment from their parents, or they didn't know that they'd been incested as a child, or things happen that the psychology of a person walls off until there's a crack in the vault, and they, it's like the scene in Ghostbusters where all the ghosts come out in New York City. It's like, so I think the question that we're talking about here is a question about, if someone has a really fracturing experience with a psychedelic in a particular setting, I think what we're talking about here is, would it have been possible if we had an alternate reality for that person to actually not have to have such a difficult path to get well, right? And some people listening to this might say, well, that's a big assumption to make, right? And it is a big assumption to make, that so-and-so might have had an easier time of getting well if they didn't have to be all blown out and, psychotic after ayahuasca for a year or something like that. But what you're talking about is really important, is that it's sort of like, it's almost like the whole point of setting a fractured leg in an ER versus setting a fractured leg on the battlefield is that the idea is that you're going to get a better result because you have all of this support in the environment. So it's kind of the same principle I think we're talking about here of psychology, is like, let's create a very supportive, controlled environment so that we can try to reduce negative outcomes.
Yeah, I like that. And, there's a lot of people where psychedelics just work well for them, and that, they like totally argue with us, like, this shouldn't be medicalized, blah, blah, blah. And it goes well for them. And that's why they're arguing that. And that's fine. I get it. Like, it goes well for those people. But what you're saying is that there's so much more opportunity for success of really getting the deepest benefits from these medicines, and they're huge. The benefits are huge when it's medicalized, because now we can control as many factors as possible and have the right trained person in there in the space with people. And I think when that's all right, there's just so much opportunities for success. It really mitigates the damages that could happen. And like you're saying, like, I don't even know if that was really set up properly. I mean, we don't know if it's not looking like in some of the trials there's that many damages really happening, right? Where there's these severe fragmentation that goes on for so long. And so I'm a big fan, as you are, of medicalizing this right now, as we learn more about medicines, and giving people the opportunity to have, profound healing in medical settings, where we can control some things. And obviously there's always going to be people doing anything on the planet by themselves, and that's just going to happen, and that's fine. And I just think that it's going to be amazing. Right now we have ketamine, and we could talk about that maybe just a little bit too. But it's just amazing that now there's medicines becoming available that people who have not experimented with psychedelics or maybe had a bad experience, they wanna come back because they have some real deep healing to do, and they've tried other things. It's just not going to happen. They've tried and tried and tried, and they need extra help. And so it's an exciting time. I think we should let's take a journey through just a few more of the medicines so that people can get acquainted. So why don't we talk about ketamine a little bit, which is cool because ketamine, you can now go to a medical setting and get it. So, Will, you want to give us a little overview of ketamine?
Sure. So ketamine is an anesthetic that was developed in the 60s. It's been around for 50 years under FDA approval. So it's not illegal, and it's actually a very important tool in a lot of different medical settings, commonly used in pediatric emergency procedures like sewing up a cut on a child's face in the ER. And while in the background there were a few people in the 1970s and 80s and even in the 90s using ketamine to treat mental health conditions, it didn't really show up on the map in the mainstream until the year 2000, when a study came out about its effectiveness for depression, which then eventually led to some studies at NIMH showing that IV ketamine had very rapid anti-suicidal and also antidepressant effects for people with treatment-resistant depression. So that later led to the development by Johnson & Johnson of a nasal spray that is, some people call it filtered ketamine. So it's part of what's in the IV ketamine. And so nowadays you can go to a clinic and you can guesstimate that you can have a 70% chance of having a robust antidepressant experience with ketamine. And along with the antidepressant effect and anti-suicidal effect with ketamine, you have a psychedelic experience, which is different in a lot of ways from some of the other psychedelic effects. It has a completely different neurochemistry from traditional psychedelics like LSD and psilocybin. But there are also benefits of that in that, people really shouldn't be taking drugs that interact with serotonin if they're taking psychedelics, traditional psychedelics, but with ketamine, because it doesn't interact directly with the serotonin system, it's completely safe to have ketamine treatment while you're taking a serotonin drug, which a lot of people who have depression or anxiety are already taking. So another difference of ketamine is that it is much shorter acting than some of the other psychedelics. So you could have a session for an hour or two in a clinic and, get a ride home and be done.
Right.
Which is really different from, say, a 12-hour journey on LSD or a 6-hour journey on psilocybin.
Totally different. And there's some real benefits to that, right? Of being able to have a shorter experience to work with and come out of and process after. And, as you said, ketamine is a dissociative. It's in a dissociative class. So it tends to be a very different experience than some of the other psychedelics. But as any psychedelic, we see, because we've, treated lots of patients now, there's a lot of different experiences that can happen, even on ketamine. Just like other psychedelics, so many different experiences can happen. And, it's really interesting that, there's obviously the dissociative quality of the psychedelic nature where you can feel kind of out of your body and maybe even in more of a transpersonal state. That happens all the time. There's also happens more of that regressive quality where people can go into a psyche and experienced traumas and things from childhood, and having to be working that edge. And it's really interesting that ketamine can have that quality of actually bringing up trauma. And people doing trauma work on ketamine, that happens every day in the clinic, right? So ketamine's it's kind of a blunt tool for depression, which is great. It just gets right at it. There's really nice efficacy with ketamine for depression. And then we also see that this kind of broader scope of the psychedelic aspect of it, where people can really have an experience that completely alters their reality, and they can hopefully do some great work with a therapist on really diving into their psyche and seeing if they can get to the underlying issues of their depression or trauma. So it's a pretty exciting tool that's available right now. And Will, do you want to say a little bit more about just, we tend to lean toward IV ketamine. Sometimes I am. You want to just say a little bit more, just so people get educated on, different routes and, what your preference is?
Sure. Yeah. I was looking carefully at this a few years ago when we were deciding, what kind of ketamine approach to take. And in the beginning, tried a number of different routes of administration. We tried intramuscular. We did some work with sublingual tablets. We did some ketamine nasal spray. And so just looking at the literature and the scope of the research, and also figuring out a way to provide IV ketamine in a really warm, kind of living room-like environment in our clinic, led all the roads pointed toward IV ketamine with psychotherapy for me. So the best of the psychotherapy approach, which we should also talk about and get into a little bit because it's so different from ordinary psychotherapy. And then the best of what we know in evidence-based medicine around the effectiveness of ketamine. So hopefully we'll have more research as time goes on to differentiate different routes of administration in ketamine, to see studies that show, like bigger studies that show intramuscular versus IV, or sublingual versus intramuscular. Spravato, the left-handed ketamine with head-to-head trial against IV ketamine. We don't have that evidence. So my thought is, let's go with what we have in terms of the evidence at this point. And finally, I'll just say, piggybacking on what you were just saying about ketamine therapy and what can happen in ketamine therapy around trauma, that although ketamine is a dissociative by class, and when people use it in a non-medical environment to dissociate or go into a K-hole kind of experience, in the medical setting with the right dose titration, what we often see is what you're saying, is that people have a full-blown psychedelic experience. They see, they have visual experiences behind the eye shades. They experience symbols that can be meaningful and that can be worked with in the therapy. They get downloads about what needs to happen next in their life. They experience transcendental states and mystical states, union with divinity, and so forth and so on. So, and it's extremely different every session for people typically. So in terms of the experiential side, I think it's very much a psychedelic. And that's sometimes a misconception that people have from people who don't have a lot of experience with ketamine, that, they think of it as a dissociative, meaning you just leave your body and that's all that happens with ketamine. And that's far from the truth.
Right. Yeah. Thanks for that overview. And I think ketamine's definitely something, we mentioned the training earlier, like ketamine's something we're going to focus on because it's available. And I think it's good for people to know that right now, as ketamine's already available, And really the things that are furthest along, the other two medicines that are the furthest along is MDMA, which is kind of next in line potentially, and then psilocybin. So we should probably just talk a little bit about MDMA and what it's been researched for. And you could say maybe just a little, Will, about, that it's in phase 3. What does that even mean? What does phase 3 mean? Yeah, why don't we hit MDMA a little bit here?
Great. So the bulk of the research has been done by this amazing nonprofit, Multidisciplinary Association for Psychedelic Studies, which was founded by Rick Doblin, who's been on our podcast before. People can go listen to that episode. It was a great conversation with him last summer about where we are with MDMA psychotherapy research. But in a nutshell, over the last 20 years, there's been a gradual and very thoughtful, methodical progression of research of MDMA psychotherapy for PTSD. So what we're seeing, again, as a broad kind of synthesis overview of the results from that research so far, is that people with chronic treatment-resistant PTSD who go into this protocol, and the protocol might be another conversation for another episode here, but essentially 3 exposures to MDMA while getting psychotherapy, 8-hour psychotherapy session each time. Total of 42 hours of therapy, including these 3 MDMA sessions over a 5-month period. People who go through that protocol and come out on the other side at the 12-month follow-up, and even beyond that, have about 2/3 of them who were very traumatized don't meet criteria for PTSD anymore at the 12-month follow-up and beyond. So a group of people with severe trauma coming into a study, having very high trauma rating scales and high levels of symptoms, going to not meeting PTSD criteria in a durable way for a year up to 3, or some of the follow-up studies go up to 3.5 years, still don't meet criteria. So it's incredibly exciting. It's a lot more effective than what we see in the research of other currently available tools, whether it's CBT or whether it's Paxil for PTSD. So currently we're in phase 3 trials. And what that means is this is the final phase before the FDA would potentially review MDMA psychotherapy for approval as a legal treatment with medical indication in this country. So the Schedule 1 is a designation for a drug that has no medical use and has a high potential of abuse. And so when MDMA was put on Schedule 1 in 1985, the claim was that it had no medical indication, no medical use. So the argument would be made at the end of phase 3, assuming that the study goes as planned, to say, look, we have a serious epidemic of PTSD. People are dying by suicide every day, 22 veterans a day in this country. We need better tools, and here's a tool that's passed the test. So that's what's happening. And the phase 3 trial is a trial where you have hundreds of patients or hundreds of people participating, and you are conducting the trial in multiple centers. So,
right. Now, well, you did as part of your training to be an investigator for MAPS, you actually underwent an MDMA session, right?
Right.
Yeah. Do you want to share a little bit about just what that was like for you? And, obviously you had a long-standing background in medicine at that point, and just what that session was like for you and what you got out of it, to give people a little flavor of MDMA.
Sure. So a little more context. MAPS was able to gain FDA approval to implement a training study, is what they called it. And so in the training study, people like me who hadn't taken MDMA were given the opportunity to undergo the protocol that as a part of our training so that we would know what it felt like to be on the receiving end of the therapy. And this was many years ago now, but the material that surfaced during that journey is still incredibly vivid in my mind and still guides some of my personal journey as a human being. And I would just say that I accessed levels of self-awareness and comprehension of early traumatic experiences and ways of healing those early traumatic experiences from my life that had been outside of my grasp for decades. And, I was a person who, as a psychiatrist, really embraced going to therapy as part of my training. And after my training was over in psychiatry residency, I continued to see a therapist off and on for many, many years, hundreds and hundreds of sessions that I went to for my own personal healing. And then going to the MAPS site and having an MDMA experience as a training, I sort of went into it as a training of thinking, oh, this is going to help me really get what it's like to be on the medicine. And it definitely did that. But I wasn't prepared I didn't know that it's like you don't know what you don't know. And so then you find out things with the support of a psychedelic that had me wondering afterward, like, are there levels of healing that are, simply put, completely beyond our ability to get to in ordinary consciousness? So it was a massive experience that was held with a lot of care and really opened my eyes in an experiential way, in a personal way, to the possibilities that these medicines, when combined with the right therapy, really represent for humanity.
Yeah. That's, anecdotally, I did MDMA once when I was in college, and it wasn't a big part of my experience. And I think I've told you this, though. Again, this is one person's story, but I had severe social anxiety. You could almost call it a social phobia. It was so severe. And I did MDMA, and it nearly completely eradicated my entire social anxiety after a lifetime of it till that point. And there's other issues for me with MDMA that happened then too, which I did because I didn't know I was bipolar at the time. So I got a little hypomanic, but and that's a different issue with MDMA. But I think that MDMA does show some really strong promise. I know we're very hopeful to see what happens here as phase 3 wraps up. I know when we talked to Rick last time, which is that you referenced, it's a good podcast to go listen to. His hope is that, assuming everything does pan out with phase 3, that we're looking at by the beginning of 2023, is what he had last said, I think. Is that right? Is that what you remember?
That sounds about right to me. Yeah.
So, of course, that's a moving target because there's a lot of powers at B here. But so MDMA is obviously seems to be a really wonderful option for PTSD, and that's really what its focus has been in the research, is PTSD. So why don't we spend just a little time on psilocybin, because that's one of the other medicines that is really being heavily researched right now. So, Will, is that going into phase 3? Is that your understanding, or is that already undergone phase 3?
My understanding is that it's about to go into phase 3. Mm-hmm.
Yeah. So what do you want to say about psilocybin? There's some really interesting indications, right, of end of life, depression, being used with cancer patients. So what do you want to say about psilocybin?
Well, psilocybin seems to be, first of all, it's performing really well in the early studies in terms of rapid and sustained antidepressant effect from just one exposure to psilocybin, which is really exciting. It also has been, as you said, it's been studied in the ways that you mentioned. I'll just add a couple more: smoking cessation and addiction protocols. So very highly successful, again, small studies, but showing, people who really couldn't stop smoking cigarettes, saying on the other side of their psilocybin experience, cigarettes are kind of irrelevant anymore in my life. So that's really exciting for those folks to have such a big support in overcoming addiction. Psilocybin is definitely another tool from the indigenous tradition that I want to keep coming back to that, because I think that it's important for us to acknowledge, as Western, as providers of Western and North American medicine, that there's a whole tradition here that spans back thousands of years, and from that indigenous perspective, which is not the perspective I speak from, I can only imagine how silly it must sound that we have these incredibly arduous and complicated pathways to get to a place where we say that psilocybin is a good thing for people to use to get well from something.
Right. It's like the long journey home. It's sort of like science catching up to technologies that we've known about for thousands of years that help people, and of course, though, science catching up in a good way, which is, well, let's refine the approaches to very complicated to very complicated human minds at this point on the planet.
Right. Yeah, exactly. Another thing I would say about psilocybin, there's been really interesting research on the default mode network with psilocybin, and this kind of phenomenon of, as we grow older and we become adults, our sense of self and our set of beliefs that we have about our life and about how reality works gets the that there's a different perspective about life is outside of the grasp of the default mode network typically. So what Robin Card-Harris and his crew at shown is that
you're breaking up, Will.
Psilocybin. Okay.
Let's try again.
When did they break up?
Mostly when you started talking about the default mode network.
Okay. Yeah, I'll just start over. So one of the things that's really interesting about psilocybin is the research on the default mode network that has been done. A lot of it has been done at the Imperial College in London with Robin Card-Harris, looking at connectivity between networks in the brain and how psilocybin can actually open up new pathways or new connections. There's crosstalk that happens between locations in the brain that normally don't talk to each other. And it's easy to extrapolate conceptually from that observation from neuroscience that psilocybin can open up your mind to seeing different perspectives, different possibilities for your life, different futures that you could create for yourself. So psilocybin is also primarily being studied as in combination with psychotherapy for depression in very similar psychotherapeutic protocols. And I want to make sure we get to the protocols because I think it's important for people. We have a lot of psychotherapists in our audience who might not be aware of how different psychotherapy and probably needs to be on a psychedelic.
Right. Yeah. So I think it's just good to note. I mean, obviously, these medicines all interact differently. Psilocybin tends to be a longer experience. It's what will is it a 6-hour protocol or is it an 8-hour protocol? Do you know?
I don't know how long the sessions are at Hopkins, but the psilocybin experience is typically a 6-hour experience.
Right. Right. So it's a bit longer. It can be an experience that comes with a lot of hallucination. It doesn't always visual hallucinations, auditory, all kinds of things can happen on psilocybin, but it's also it's starting to look like a very powerful tool that hopefully we'll all have access to in the coming years. Well, we covered. Let's just, as we're wrapping up, well, we covered ayahuasca, which is important because a lot of people are asking questions about it. We're going and flying places and doing it, and we covered ketamine, which is important because it's actually something you can go get access to right now at a clinic. We covered MDMA, which is important because it's actually in phase 3 and things are looking very positive, and that might be something available within 1 to 2 years. And then psilocybin is similarly, where it seems like psilocybin is looking very positive for depression and some other indications. So I think for today, maybe we don't get into the other hallucinogens that people experiment with, like LSD or peyote or other things too. Maybe we don't get into that per se, but I think what I would like to wrap up with here is that, particularly as a therapist, in my mind as a therapist, being a therapist, and to me, it seems like at this point, this is going to become, you said this at the beginning, Will, this is going to become a major part of one of the tools available to psychotherapy. And I think that every therapist in the next 1 to 5 years will need at least a good solid education around psychedelics, even if they don't choose to get involved directly with psychedelics, but really understanding the tool, because a lot of clients, it's looking like a lot of clients are going to be using these tools in coming years. And so it's an exciting, we are on a basically a revolution in mental health care right now with the coming of psychedelics. And I have a lot of faith we're going to do this properly this time and use these properly and really help a ton of people. A ton of people are going to get really good help because of how seriously people are taking how to use these medically and doing the research properly. And so it's a really exciting time. Anything you want to add to that, Will?
Yeah, it is. It is a very exciting time for mental health care, and I think it's going to be important for people. I'm just going to speak from my own experience as it's I'm a psychiatrist, but I was a 25 hours of psychotherapy providing a week kind of psychiatrist. So I was pretty much a psychotherapist who prescribed medication and did integrative care with people for many years until I got recruited onto this MAP study. And I'll just tell you the level of that I had to undergo to be able to provide effective MDMA psychotherapy was substantial. And so psychedelics are not just a bolt-on that you add to your role as a psychotherapist. You've got to learn new tools. And there are a lot of reasons for that. I mean, one being, probably the main one being that when someone is on a psychedelic, their cognitive functioning is extremely altered. And so doing any kind of cognitive therapy or any kind of interpretation kind of therapy, which is something a lot of people do, doesn't work very effectively. And so somatic techniques, trauma therapy techniques, being able to hold space, with very disturbing content and not interfere with the process of the client. These are all tools that a lot of therapists really don't have much background with. So it's a unique and potentially massive shift in how we orient toward resolving PTSD and depression.
Yeah. Thanks for adding all those pieces, and that we're really excited. Everybody, stay tuned. So, in the coming weeks, we're going to be talking about registration being open for a psychedelic therapy training program. We're super excited about it, and we're going to this program's going to focus on getting people up to speed on what Will just talked about. Understanding first the medicines, the research of the medicines, which is super important, having that education, and then really understanding how to practice with those medicines and hold that space that Will's talking about. So more to come. We won't tell you yet who's going to be teaching in this program, but again, we're psyched. We've got some amazing people that we'll be talking about in coming weeks. And should we end there, Will?
Sounds good, Keith.
All right. Thanks, Will.